If you have just had an early pregnancy scan and you are staring at the report, feeling more confused than reassured, this video is for you. I'm not here to predict outcomes. I'm not here to tell you what will or what won't happen. I'm here to help you understand the language used in early pregnancy scans so you don't panic over words that aren't meant to scare you. If you are looking for guarantees or timelines, this video might not be for you. But if you want to understand how doctors read these reports calmly, stay with me. I'm Dr. Gayathri. I'm a women's imaging specialist and I am here to decode radiology reports so that you can be more at peace when you get the report. In this video, I'm decoding early pregnancy scan reports. I will be breaking down a lot more detailed scan reports in the future, so make sure you subscribe and don't miss them. Let's start with something important. Early pregnancy scans are often misunderstood. These scans are not designed to give you certainty. They are designed to answer very specific questions in a specific order. In simple terms, doctors are checking for three things: where is the pregnancy, how early is it, and what stage of development fits this timing. That's it. Not outcomes, not guarantees, not the future. So, if you're going into a early pregnancy scan expecting reassurance about how everything will turn out, you are expecting something the scan was never built to provide. Once you understand this, the report starts making a lot more sense. Throughout this video, I will be talking about repeating the scan to get more information. If you want to avoid repeats, 6 to 7 weeks is the most economical time for the first scan. But remember, scanning as early as 5 weeks helps us detect problems sooner. Let's go through the report line by line. This can be this or this. Abdominal scans are external scans. It is not the best way to do a pregnancy scan this early, but for some reason, this was the type of scan used. Transvaginal scan is an internal scan. It is the best method to do the early scan. Values and measurements are much more accurate and clear. If you haven't gotten your scan done yet and thinking of getting one, I strongly recommend get the internal scan, the transvaginal scan. Let's talk about the gestational sac next. The most important line a gynec looks for in the report, because this line can change the entire process for them. Why do you ask? Let me explain. Gestation refers to the pregnancy, and the sac is how we refer to the tissue that holds the pregnancy together. This mentions that the pregnancy tissue is actually present and is seen in the ultrasound scan. The first part of this sentence refers to where the tissue is seen, and like I said, this could be the most crucial information for the gynecologist. Extrauterine means the pregnancy is not in the uterus, meaning the sac is outside the uterus, and this is definitely abnormal. If you see this in your report, stop this video right away and contact your gynecologist right now. I mean, right now. There is a high probability that this pregnancy will not continue, and even more importantly, delaying the visit to your gynec can cause irreversible harm to you. So do not take this lightly. This means the pregnancy is in the uterus and this is normal. Do not panic when you see this. You might just be too early. You have two options now. Option 1, wait for another week and repeat the scan. That gives the sac a little bit more time to grow and can be more clearly visible in the scan. Option 2, reconfirm your pregnancy with a beta HCG blood test. If you're already doing a repeat scan or too curious, this blood test will reconfirm the pregnancy. The next thing to look for is the yolk sac. It's either already in your report or your scan is too early for it. Another line you might see is yolk sac visualized. Simply put, the yolk sac is an early support structure seen in early pregnancy. This takes care of providing the embryo with the necessary nutrients. This line not being there does not mean there are issues. Again, you might be too early. Wait for another week and repeat the scan, but not more than 2 weeks. Scanning late can delay crucial information. The yolk sac being smaller than 2 mm or larger than 5 mm means something could be abnormal. Nothing crucial, but this definitely means that this pregnancy needs more attention and care. Make sure you don't skip any future appointments as they are extra important in this case. A yolk sac that is between 2 to 5 millimeters in size is completely normal. The next thing to look for is the embryo. It's either already in your report or your scan is too early for it. The fetal pole or embryo is the early tiny structure that later becomes the baby. CRL is a measurement of the length of the fetus taken on the scan. It is used to estimate timing. Doctors expect small differences here, especially early on. Measurements can vary slightly based on the angle, visibility, and how early the scan is. This is why scan dates and period dates don't always match exactly. This line causes a lot of anxiety. If the scan is done very early, some structures simply won't be visible yet. Wait for another week and repeat the scan. But not more than 2 weeks. Scanning late can delay crucial information. If the fetal pole measures more than 7 millimeters but there is no heartbeat, let me tell you again, if the measurement of the fetal pole is more than 7 millimeters and you also see this line in the report, it is a difficult finding and I'm sorry. It usually means the pregnancy won't continue. I know it's hard to hear this. Meet your gynec to support and guide you through the next steps. If this is what your report reads, it is normal. The next thing to look for is the heartbeat. It is either already in your report or your scan is too early for it. Let me talk about what this is. Cardiac means heart, and this line talks about the heart being active. Seeing this line might scare you. In most cases, you are just too early for your scan. Wait for another week and repeat the scan, but not more than 2 weeks. Although, like I mentioned before, this line coupled with the fetal pole measuring over 7 mm is a problem. Reach out to your gynec, you need support at this point. This line means the baby has a beating heart and it is beating at a normal rhythm. If the number here is between 120 and 180, it means it is normal. If the beats per minute is less than 110, this causes concern. This means this pregnancy could need extra attention and care. Make sure you do not skip any future scans as they are extra important in this case. The next checkpoint is the NT scan. This is done 11 weeks after the last period date but before 14 weeks. The next lines are rare but they are definitely important. Os is the door that keeps the contents of the uterus inside of it. This means it is closed and normal. This means it is open, and this being open means the baby can literally fall out. But there is a fix. Your gynec can stitch this close and prevent this from happening. Cervix size talks about how long the cervix is. Cervix being over 3 centimeters is normal. If it is less than 3 centimeters, you will need a stitch. Go and meet your gynec. You might also see something like a SCH or subchorionic bleed. This refers to a small bleed near the pregnancy. Doctors see this as a descriptive finding, not an automatic danger sign. What matters is size, location, and whether it changes over time. Seeing small amounts of bleeding simply means you need more physical rest and you need to be more careful and get more medical attention. On its own, this line does not always predict outcome. It's something to observe, not panic over. Visit your gynecologist for reassurance. One of the hardest parts of early pregnancy is being told to wait. Waiting is not indecision. Waiting is intentional medicine. Early pregnancy changes quickly, and time itself provides information that a single scan cannot. Repeat scans are not a sign that something went wrong. They are a part of how clarity is built safely. Doctors wait not because they don't care, but because guessing too early causes more harm than help. Some structures just take time to grow, and time is the only way we can tell if things are good. So don't panic, just trust the process. There are a few things I strongly recommend not doing after reading an early pregnancy scan report. Don't Google timelines obsessively. Most information online is taken out of context. Don't compare your scan week by week with someone else's. Early development varies more than people realize. And most importantly, don't read one line in isolation. Reports are meant to be read as a whole, in context, over time. Protecting your mental space at this stage is just as important as any scan. I want to end by saying this clearly. This video is not meant to predict outcomes. It's not meant to reassure or alarm. It's meant to help you read your scan language without panic and understand how doctors think when they look at these reports. If you see any other lines on your report that you need clarity for, mention them in the comments below and I'll provide the required clarity. Let's stick to early pregnancy scans in this video. I'll explain the other scan reports very soon. If this helped you slow down your thoughts even a little, feel free to save it or share it with someone who might need it. Take care.